Did you know that bowel cancer is one of the most prevalent types worldwide? Unfortunately, this disease is affecting more and more people, and many only discover the problem at advanced stages, when treatment becomes much more complicated. For this reason, it is crucial that you stay alert to the signs and symptoms associated with bowel cancer and know how to recognize them. In this video, we will explore everything you need to know about this condition, covering risk factors, signs and symptoms, as well as available treatment options. Stay informed about the most relevant issues and discover how to protect yourself from bowel cancer. Remember, your health is your most precious asset. Before we proceed, don't forget to like the video. Subscribe to our channel, as nearly 90% of people who watch our weekly videos forget to subscribe and therefore don't receive the valuable health tips and information that can make a difference in their lives. We thank all those who are already part of our family and continue to follow us. Now that you've subscribed and recognized the importance of understanding the signs and symptoms of bowel cancer or colon cancer, let's move forward. Before diving into the details of the signs and symptoms of bowel cancer, it's important to highlight the relevance of discussing this topic. This disease has been affecting an increasing number of people worldwide, resulting in approximately 700,000 deaths annually. In Brazil, bowel cancer is the second most common type among women and the third most common among men. According to the National Cancer Institute, INCA, around 41,000 new cases of the disease were estimated in Brazil in 2020. These figures highlight the urgent need to discuss and raise awareness about the prevention and early diagnosis of bowel cancer. In this video, we will cover the main signs and symptoms of the disease to help you identify potential warning signs. Early detection can save lives. What are the risk factors? Some factors can increase the likelihood of a person developing bowel cancer. These include age, as people over 50 are at higher risk, a family history of bowel cancer, inflammatory bowel diseases, and an unhealthy lifestyle. Furthermore, diet can also influence the development of bowel cancer. A diet rich in processed foods, saturated fats, and red meats can increase the risk of the disease. On the other hand, a diet rich in fruits, vegetables, legumes, and fiber could be a preventive factor. It's worth noting that although these risk factors may increase the chances of developing bowel cancer, not everyone with these characteristics will necessarily become ill. Therefore, prevention and early diagnosis remain the best strategies to combat this illness. You might be wondering, what are the signs and symptoms of bowel cancer? Symptoms can vary among individuals, but there are certain warning signs that deserve attention. Among these signs are changes in bowel habits, such as diarrhea or constipation, which can be indicative of bowel cancer. If you notice any change in your bowel habits, it is essential to seek a medical evaluation. The presence of blood in the stool is also a warning sign. Blood in the stool may indicate lesions in the bowel, such as polyps or tumors. The blood may appear on toilet paper, in the stool, or in the toilet water. Additionally, abdominal pain may indicate bowel tumors. This pain can be constant or intermittent and often worsens after eating. Another sign to watch for is unexplained weight loss, which can occur due to a loss of appetite or the body's difficulty absorbing nutrients. Constant fatigue and weakness can also be symptoms of bowel cancer, especially in more advanced stages of the disease. Anemia, characterized by a decrease in red blood cells in the blood, may be a sign of gastrointestinal bleeding, which occurs in some cases of bowel cancer. Additionally, a persistent feeling of bloating or abdominal discomfort can indicate the presence of the disease. Nausea and vomiting may also appear in more advanced stages of bowel cancer. It is essential to pay attention to any changes in bowel habits and see a doctor if symptoms persist for more than 2 weeks. Early diagnosis is vital for successful treatment, so do not ignore warning signs. Also, remember that many people do not show symptoms in the early stages of bowel cancer, making it essential to have regular preventive screenings. A colonoscopy, for example, is an effective method for detecting the disease in its early stages, when treatment is simpler and more effective. Pay attention to changes in your bowel habits and have regular preventive screenings. Your health deserves all the attention and care. Prevention and early diagnosis are key to fighting bowel cancer. The earlier the disease is identified, the greater the chances of successful treatment and cure. Therefore, it is important to adopt healthy habits, such as maintaining a balanced diet rich in fiber and low in fats and red meat. Additionally, avoiding excessive alcohol consumption and not smoking are essential actions. Regular physical exercise is also beneficial in preventing bowel cancer, contributing to a healthier and more balanced life. Along with these preventive measures, frequent routine exams are crucial. Colonoscopy is the most effective method for detecting bowel cancer in its early stages, when treatment is simpler and the chances of cure are significantly higher. Don't put it off. Taking care of your health is an investment that is worth it. Adopt healthy habits, have regular preventive screenings, and always stay alert to the warning signs of bowel cancer. With care and prevention, it is possible to overcome this disease. Now, if bowel cancer is diagnosed, there are several treatment options available, which vary depending on the stage of the disease and the patient's overall health. The options include surgery, radiotherapy, chemotherapy, and targeted therapy, which are drugs that specifically target cancer cells. However, it is important to stress that the appropriate treatment can only be recommended by a specialist doctor. Therefore, it is essential to seek specialized medical assistance if there is any suspicion of the disease or symptoms related to bowel cancer. Only a healthcare professional can make an accurate diagnosis and suggest the most appropriate treatment for each case. Additionally, medical follow-up is crucial throughout the process to ensure the effectiveness of the treatment and the patient's recovery. Do not hesitate to seek specialized medical help if you experience symptoms associated with bowel cancer. Taking care of your health is essential for a full and happy life.